It may not be possible to eliminate the risk of challenging behaviour in the workplace. The types of control measures that will eliminate the possibility of physical injury to workers, such as restrictive practices or isolation, are also the types of control measures that decrease the quality of care, actually increase the likelihood of challenging behaviour incidents occurring, and may create a health and safety risk to the individual receiving care or treatment, be them physical or psychological. Where the risk cannot be eliminated, organisations need to ensure that risks are minimised so far as is reasonably practicable. 4 fundamental areas that are key to controlling challenging behaviour risks include worker training, capability and ongoing development, the care environment, effective communication, and the identification, planning and management of risk. Tool 2 of SA Health Challenging Behaviour Toolkit is an organisation-wide self-assessment audit tool aimed at challenging behaviour committees. However, the tool is a valuable resource that may be used by any healthcare or social assistance organisation to identify gaps in their preventative strategies and risk control measures.